Safe Nurse-to-Patient Ratios by Abby Alexander. Several regulations have been put in place in each state that requires hospitals to have adequate numbers of registered nurses on staff. In 2004, California began implementing a law requiring all of its hospitals to limit the numbers of patients that its nurses could treat at any given time. The limit would vary depending on the hospital setting. For instance, the ratio in an OR can't exceed one nurse for every one patient, while a med-surg unit can have up to 6 patients for every nurse, and an emergency room units can have up to 4 patients per nurse. Before regulations went into effect, some nurses would have as many as 10 or more patients to tend to at a time on every shift. They would wear themselves out trying to treat each one. Every nurse's shift was rushed and exhausting, and simple mistakes or miscues became more common than they needed to be. Nurses may also be assigned to float or work mandatory overtime during their shift. Floating usually occurs when staffing is short. The float nurse would help out other nurses complete tasks that they are too busy to manage on their own. Many facilities are starting to decrease their use of mandatory overtime due to growing research linking overtime with medical errors. Average nurse-to-patient ratios per unit. A med-surg unit can have up to 6 patients per nurse. In the emergency room, they can have up to 4 patients. An ICU unit can have up to 3 patients per nurse, and a step-down unit can have up to 5 patients per nurse. Effects of inappropriate nurse-to-patient ratios. These effects can be negative patient outcomes, decrease in quality care, longer length of stay for patients, nurse burnout, and readmissions. Readmissions most commonly occur because of infections. Nurses are vital for preventing and assessing for signs of infections. When understaffed, they don't have the time to properly assess each patient. Competencies. The overall goal for the Quality and Safety Education for Nurses project is to meet the challenge of preparing future nurses who will have the knowledge, skills, and attitudes necessary to continually improve the quality and safety of the healthcare systems within which they work. The safety competency goal is to minimize risk of harm to patients and providers through both system effectiveness and individual performance. The quality improvement goal is to use data to monitor the outcomes of care processes and use improvement methods to design and test changes to continuously improve the quality and safety of healthcare systems. There is currently many research projects being done to determine what is the appropriate and safe number of patients to assign to each nurse. Active communication and collaboration among health professionals is imperative to providing safe, patient-centered care. The Essentials of Bachelor Education for Professional Nursing Practice provides the educational framework for the preparation of professional nurses. The BSN Essential I chose was Essential number 6. Interprofessional communication and collaboration for improving patient health outcomes. Some of their goals include advocate for high quality and safe patient care as a member of the interprofessional team, incorporate effective communication techniques, including negotiation and conflict resolution, to produce positive professional working relationships, and to contribute the unique nursing perspective to interprofessional teams to optimize patient outcomes. And these are the references that I used to make this PowerPoint.